Have you or someone you know been diagnosed with kidney disease? Diagnosing kidney disease. When your doctor diagnoses that you have kidney disease, there are 5 stages you will progress through. Stage 1, Stage 2, Stage 3A, Stage 3B, Stage 4, and Stage 5. Stage 4 is the last stage before Stage 5, which means you require dialysis or a transplant. 80 to 90% of kidney disease patients don't receive a diagnosis until Stage 4. Stage 5 is dialysis or transplant list. The good news is, even if you're at Stage 4, it's possible to turn back the clock and reverse your kidney disease by 1 or even 2 stages in as little as 90 days. The medical community does not believe this is possible, but it is. Ask any patient I've worked with or their provider and they will tell you different. Here's a great example of a success story. The patient presented entering Stage 4. At 90 days, the follow-up lab work revealed he was now Stage 1. That's a 3-stage reversal. I have a large number of physician endorsements. A friend of mine who practices in Atlanta caught COVID. Her kidneys went downhill quickly. She used the protocol and her kidneys were restored to complete normal function. Another physician, a friend of mine in Pensacola, he sent me an email recently and stated that every patient who used the protocol saw their kidneys go in reverse. Everything I do is based on EBM, evidence-based medicine. I have a huge volume of peer-reviewed medical literature that supports everything I do. Biomarkers. These are the individual measurements on your laboratory test results. Creatinine is the primary biomarker your doctor uses to determine your kidney function. Creatinine is generated from your muscles and is cleared through the kidneys. So when creatinine rises, that indicates you're starting to lose kidney function. Causes. Diabetes and hypertension are the 2 primary causes of kidney disease. Solutions. Routinely, diabetes and hypertension are addressed. However, there are other risk factors that can be considered. Low-grade acidosis and low normal thyroid function. Recent medical literature confirms this. Addressing these 2 additional risk factors can help you recover lost kidney function. First step, most important step, this is very important. You got to get an accurate diagnosis. Most kidney disease patients, 80 to 90%, never get a diagnosis until Stage 4. That's unacceptable. If you request 2 other measurements, it'll help you pinpoint where your kidneys are. Ask for a urine catch, they'll look for albumin or protein, and ask for a blood marker known as cystatin C. That'll be 3 measurements that'll pinpoint the status of your kidney function. There are 2 important things that usually get overlooked and never considered. One is acidosis. It's hard to spot because bicarbonate is a normal route of diagnosis, but unfortunately it deteriorates late at Stage 4. There's 2 biomarkers you can ask for that will pinpoint that there is acidosis. One is urine citrate, normally used for kidney stones. The other is total CO2. If they've deteriorated, that means you're acidotic. That can happen at Stage 1 and actually damage your kidneys before anybody notices. Second condition that needs to be considered is subclinical hypothyroid. What does that mean? It means slightly low thyroid function. That can take you back a whole stage if it's corrected. So you need to request a more rigorous exam of your thyroid function. Thyroid function when it's low can cause kidney disease. Kidney disease can cause low thyroid function. It doesn't really matter. You need to address that and correct it. We covered acidosis and we covered low thyroid function. There's more you can do. There's a number of supplements that are inexpensive and easy to take. The B vitamins, riboflavin, B2, it's over the counter, B6, which is also over the counter. And then there's B9 and B12, folic acid and B12. Unfortunately, they don't work very well unless they're methylated. And the B12 is known as cyanocobalamin. The cyano side chain actually cleaves off and becomes cyanide. That's clearly a bad idea. You need to use the methylated versions, methylfolate and methylcobalamin. They're safe and they're the active forms of those two vitamins. Even further beyond that, you can use what you normally would consume in citrus fruit, the fiber. They call it citrus pectin. That citrus pectin helps prevent fibrosis, not only in the kidneys, but the heart and everywhere else in the body. It's inexpensive, a few spoonfuls a day, and you're helping your kidneys stay healthy. If you are interested in a solution, please contact me.